The job description of a travel nurse focuses on providing high-quality patient care while working temporary assignments in different hospitals, clinics, and healthcare facilities across various regions. Travel nurses fill staffing gaps created by shortages, seasonal demands, or special medical needs. Their role is uniquely dynamic because they adapt to new environments, protocols, and patient populations frequently. These professionals bring flexibility, clinical expertise, and strong problem-solving abilities to every assignment, ensuring continuity of care where it is needed most. Travel nurses often work through staffing agencies that coordinate placements, housing arrangements, contract durations, and travel logistics. Assignments can last from a few weeks to several months depending on the needs of the facility. This type of nursing appeals to individuals who enjoy change, variety, and the opportunity to gain broad clinical experience in diverse settings. Travel nurses may work in emergency departments, intensive care units, medical surgical floors, labor and delivery, or specialized units depending on their background and certifications. Primary responsibilities of a travel nurse. The responsibilities of a travel nurse mirror those of a permanent staff nurse, but with added expectations of adaptability and quick learning. Travel nurses assess patients thoroughly, recording vital signs, collecting medical histories, and identifying symptoms that require immediate attention. They collaborate with physicians and interdisciplinary teams to create individualized care plans that support recovery and meet facility standards. Medication administration is a central task. Travel nurses follow strict protocols to dispense medications accurately, monitor reactions, and educate patients on usage. They must be familiar with electronic health record systems, though these may differ between facilities. Learning new documentation systems quickly is essential to maintaining workflow and ensuring accurate charting. Travel nurses also perform wound care, assist with procedures, monitor lab results, and respond to emergencies. Their ability to recognize deterioration early and communicate changes promptly is critical for patient safety. Because travel nurses often work in units experiencing staffing shortages, they must maintain stamina, manage time effectively, and prioritize tasks under pressure. Patient education is another key responsibility. Travel nurses teach patients and their families about treatments, medication routines, recovery expectations, and long-term health maintenance. They help alleviate fears and answer questions, especially when patients are navigating unfamiliar diagnoses or hospital environments. Midway through this discussion, it becomes clear that the job description of a travel nurse requires more than technical skill. It demands emotional resilience, cultural sensitivity, and a willingness to integrate seamlessly into new teams. Travel nurses act as temporary yet essential members of the healthcare workforce, supporting patient outcomes even in high-stress or unfamiliar settings. Essential skills and qualities for the role. A successful travel nurse must possess strong clinical skills and the ability to adapt quickly. Because they transition between facilities regularly, they must be flexible with workflows, equipment, and protocols. The ability to learn new environments swiftly enables them to provide consistent care from the moment they arrive on assignment. Communication skills are vital. Travel nurses interact with new colleagues, physicians, patients, and families in every placement. Clear, compassionate communication ensures safety, builds trust, and promotes teamwork. Positive collaboration is especially important when stepping into units that may be understaffed or overwhelmed. Problem-solving skills are equally important. Travel nurses often face unfamiliar situations, limited orientation time, and varying expectations from one facility to another. They must think critically, remain calm, and make informed decisions in fast-paced environments. Clinical judgment, confidence, and situational awareness help them navigate these challenges effectively. Emotional resilience is essential. Working away from home, adjusting to new routines, and caring for diverse patient populations can be demanding. Travel nurses must maintain professionalism, empathy, and patience even when dealing with stress, fatigue, or emotional cases. Organizational skills support their success across different assignments. Travel nurses manage schedules, licensing paperwork, housing arrangements, and travel plans while balancing demanding clinical duties. Strong time management helps them meet responsibilities without compromising quality. Work environment and challenges. Travel nurses work in hospitals, outpatient centers, rehabilitation facilities, and emergency care environments across the country. Each assignment may differ in pace, unit culture, team structure, and patient demographics. They frequently work long shifts, including nights, weekends, and holidays, depending on facility needs. The role involves adapting to varied environments such as rural clinics, urban trauma centers, or coastal hospitals affected by seasonal patient surges. Travel nurses may treat high-acuity patients, respond to emergencies, or handle large caseloads. The continuous learning curve can be challenging but also rewarding for nurses who thrive on variety and growth. One of the most significant challenges is short orientation time. Travel nurses often receive only a quick overview of the unit before starting full responsibilities. This requires confidence, resourcefulness, and the ability to ask questions when needed. Housing logistics, travel fatigue, and living away from family can also be difficult aspects of the profession. Despite these challenges, travel nursing offers exceptional benefits. Nurses gain exposure to different specialties, expand their clinical expertise, and earn competitive compensation. Many enjoy the opportunity to explore new cities, meet new people, and build experience that enhances long-term career growth. The flexibility to choose assignment locations and contract lengths also appeals to those seeking autonomy. Educational requirements and training. Travel nurses must be licensed registered nurses, typically holding an associate degree or a bachelor's degree in nursing. Clinical experience is essential, with most agencies requiring at least 1 to 2 years of experience in a specialty area. Additional certifications such as BLS, ACLS, PALS, or specialty-specific credentials increase competitiveness for assignments. Training for travel nursing focuses on maintaining clinical competence, understanding agency requirements, managing licensure across states, and preparing for varied clinical environments. Nurses may pursue continuing education to stay current with best practices and ensure readiness for specialized units. Conclusion. The job description of a travel nurse highlights a role rooted in adaptability, clinical excellence, and compassionate patient care across diverse geographical locations. Travel nurses provide vital support to healthcare facilities facing staffing shortages or high patient volumes. Their contributions enhance patient outcomes while offering them opportunities for professional development, cultural exposure, and career flexibility. For nurses who value mobility, independence, and meaningful clinical work, travel nursing presents a fulfilling and impactful career path.